excellent. Thank you so much. All right. Okay. Perfect. All right. Welcome, everybody. I'm so excited to be talking about applications of data-based measures pre and post diagnosis with you this evening. And there we go. All right, so some of the goals for this series more generally, so this is part 3, is to empower parents to participate in their child's home ABA program, to provide parents with the tools needed to assess their child's progress and evaluate the effectiveness of their child's home ABA program, and to reduce the barriers associated with parent education. Please ask questions throughout the presentation. I will stop speaking several times to cover your questions. As a question comes up, please put it in the question box so that you don't forget your question as we go here. I will cover lots of information today, and the slides will be provided to you in a follow-up email after this presentation has been completed. If you attended one of my previous presentations and have additional questions, please ask them during the first question break of this presentation. I would be happy to answer them for you. All right, topics covered in this presentation will be when and why would you record data, types of data recorded, selecting a recording method, graphable data and non-graphable data, start recording, what to do with raw data, and then I'll go through 2 applications of the data collection process to model for you how you might collect data for a few different scenarios. In this presentation, I will primarily use the term parent to describe the adult caring for the person receiving ABA services, and I will primarily use the term child to describe the person receiving ABA services. The term parent can be substituted for caregiver or guardian, etc., and the term child is applicable to any learner, client, student of any age. Okay, so let's get right into it. Why should we record data? Well, you might record data to provide an objective record of observations to a service provider. So someone like a BCBA, an SLP, BCBA is a board certified behavior analyst, SLP, speech language pathologist, an MD, medical doctor, or a psychologist, etc. You may also record data to evaluate the effects of behavioral or medical interventions. So behavioral interventions may be something that was recommended for you to implement from your service provider, like your BCBA, or maybe another service provider that you see that may provide some behavioral support, or a medical intervention. So maybe your child was placed on medication from a pediatrician for ADHD, or even antibiotics, for example. You may want to take some data to observe the effects of those medications on certain behaviors. You may also want to take data to evaluate the effects of environmental changes. So that could be changes like using a new laundry soap to wash your child's bedding. It could be changing all of your light bulbs in your house to be dimmable if your child is sensitive to light. So you may want to take data on certain behaviors associated with these environmental changes to see if there actually is a change in behavior from making changes in your environment. And then also to identify patterns in behavior. All right, so for the first point, we're going to talk about the record of observations. So an autism assessment team may request specific details about your child's strengths and challenges. Having some data available to share will provide the team with a comprehensive picture of your child. It will also take the pressure off of you during a stressful appointment to remember to share all of the details. This is also really relevant if you go to see some kind of specialist, like a pediatrician perhaps that specializes in prescribing medications for individuals with developmental disabilities. It may be helpful just to have some of that data there so that you're not having to remember everything in the moment. Or even maybe this will help you take some notes that you can bring with you. It can also be very challenging because you will have your child there with you or your teenager, whoever it is. So you may be trying to support them while also sharing your concerns with the treatment team, the assessment team, the doctor, whoever it is. A medical doctor may also require detailed information in order to prescribe medications to support your child's treatment program. So there are several pediatricians and psychiatrists out there that will require some data to be able to best prescribe medication for your child to support their treatment package. A psychologist may also require information on behaviors of concern in order to provide a secondary diagnosis. So some individuals with ASD may get a secondary diagnosis of ADD, ADHD, OCD, obsessive compulsive disorder, and other secondary diagnoses. So you may need to take some data as well to be able to access those diagnoses. So to evaluate the effects of behavioral or, sorry, I'm just going to change where my video is here. To evaluate the effects of behavioral or medical interventions. So your BCBA may ask you to record data on behaviors of concern at home to identify the effects of interventions applied during home sessions to see if they generalize outside of sessions. So this is one thing that I've started to do with some of my families who are implementing skills-based treatment developed by Dr. Greg Hanley and his team. We've been implementing this treatment primarily during home sessions. Some parents, of course, are also doing sessions themselves. But for those that aren't doing sessions themselves, we're trying to see if there's some generalization of a reduction in challenging behavior outside of home sessions as well. So I may ask parents to take some data on challenging behavior outside of sessions to see if we observe a decrease in those behaviors as well. And your family doctor may require detailed information on the levels of challenging behavior after prescribing a medication to support your child's treatment plan. So that could be things like decreasing aggression towards others, for example. You may also want to take data to evaluate the effects of environmental changes. So things like after a visit to the allergist, you may want to record data on the levels of behavior, the levels of challenging behavior to identify if behaviors are reduced following the elimination of something in your child's diet. So maybe it's egg. Maybe your child has an egg sensitivity that shows up on an allergy test. And maybe you went to the allergist because your child was often getting agitated after eating. So you may want to take some data to see if there's a change in behavior after taking egg out of your child's diet. This is just an example. You may have noticed that your child engages in increased aggression towards others during the summer. You may want to record data on aggression throughout the summer, along with the daily temperatures outside, to identify if there's a correlation or a relationship between the temperature and aggression. I know sometimes when it's really hot out, I feel increasingly agitated myself. So that might also be happening to an individual with ASD who may not be able to explain to us that they're becoming agitated to the point of engaging in aggression towards others because they are so hot. We may also take data to identify patterns in behavior. So we may want to evaluate the timeline of challenging behaviors preceding someone's menstrual cycle, for example. We may also want to evaluate an increase in challenging behaviors following more than 2 days without intervention sessions. I know a lot of my students, they have the weekends off of sessions and then we come back on Monday, and there's often more challenging behavior on a Monday than any other day because there's been some time off of sessions. So if we can take some data on that, then we may be able to adjust our plan after there's been some time without sessions so that the student can be more happy, relaxed, and engaged during their session and not be so agitated. All right, so there are a few different types of data that we can record. So the first type of data we can record is baseline. Baseline is data that's recorded before an intervention is administered. So this is when things are business as usual. That's when baseline is collected. We don't want to change anything. We just want to take data on the specific behavior of interest. So we'll want to identify the levels of behavior prior to intervention. Then we will take treatment data. Treatment data is recorded during treatment to identify if the treatment is effective. And then maintenance data is recorded once formal treatment has been discontinued or faded out to identify if the treatment effects are maintained over time in the natural environment. And just to clarify as well, faded out just means that something is slowly removed. So when we stop a treatment, oftentimes we are slowly decreasing the dose of that treatment so that the student can begin to engage in those behaviors in the natural environment like we want them to. If we discontinue a treatment without fading it out slowly or removing it slowly, we're at risk of seeing a regression in the treatment gains that we've made. So that's just what faded out means. Selecting a recording method. So there are a few steps for selecting a recording method. A few of the terms I'm going to talk about now were covered in detail in my last talk in part 2. So I encourage you to watch that if you haven't already. I will review the terms a little bit here, but for a deeper understanding, highly recommend watching that one as well. So the first step is to identify the behavior or behaviors to be measured. The next step is to write an operational definition, and that's just what the behavior looks like. Then we're going to reference this presentation for descriptions of each recording method and important points to consider for each recording method before we select which one we're going to use. So I'm going to go into each of these things in more detail. So for step 1, we're going to identify the behaviors to be measured. We need to decide which behavior or behaviors we will measure. You need to break down complex behaviors into multiple behaviors. So rather than measuring a single behavior called vocal protest, you may want to choose to measure crying, screaming, and refusals all separately. Next, you will want to name the behavior. So some names for behaviors might be picking nose, mouthing. Mouthing is placing things that are inedible in the mouth most often. Hitting with an open hand, biting knee, slapping objects. Those are just some examples of names for behavior. And in the next step, you'll need to write an operational definition for each behavior. You need to make your definition observable. The behavior must be defined in terms that all observers can agree upon the occurrence and the non-occurrence of the behavior. So some ways that we can describe behavior are by the topography. So that's what the behavior looks like. So if we're talking about hitting looks very different for every child, adult, person. So hitting with an open hand, for example, like this. Using a pincer grasp to place a block onto the tower. So that's a grasp like this with your index finger and your thumb versus maybe using a hand to place a block, okay? So those are what those behaviors look like. And this is really important because you want all observers to agree upon the behavior they're looking at in order to accurately take data on it. This is one of the challenges that we have with home teams is we have so many behavior interventionists on every home team. Everyone needs to understand what the exact behavior we're measuring looks like. So it's really important for interventionists to be trained on the child's behavior plan, to know what those behaviors look like so that they can take data on them. And then maybe even more importantly, intervene on them. Also important for parents as well when we're providing parent support. The other way that we can describe behavior in an operational definition is by the magnitude, so the size of the behavior. So was it a touch or was it a punch? And then also the latency. So that might be the length of time between the instruction and the behavior. So maybe it's a latency of 10 seconds before someone says help, please, when we show them a picture symbol that stands for help. All right, so the next two pieces of operational definitions are to make sure that your definition is measurable. So, what constitutes one event of that behavior? When does one event of vocal protest end and the next one begin? So, vocal protest, again, the definition varies depending on the person, but we could say for this presentation, vocal protest means crying with or without tears, screaming, and refusals. So like saying like, no, I don't want to do that, or no, go away, or no, I don't want to work with you today. So that might be vocal protest. So when does one event of that end and the next begin? It's challenging. If a student is crying for 1 minute, takes a big deep breath, and then starts crying again, is that one event of crying or two events of crying? Our operational definition needs to tell us that. What magnitude of vocal protest needs to occur in order for an event of vocal protest to be recorded? So does it need to be a full-on cry, or can just a be vocal protest? We need to know. It's important. Because if we don't know, our data is not going to be accurate. And this is one of the important things on home teams. If BI number 1 is recording as vocal protest, along with all of the other high magnitude vocal protests, they're going to have a lot more vocal protest recorded in their session than BI number 2, who's only recording screaming and crying, for example. And the third part of an operational definition is making your definition repeatable. So the definition must describe all times that the behavior occurs. So we won't use, we need a definition that withstands the test of time. Behaviors can change over time in the way that they look. So we need to update our definition accordingly. But this definition, when we start with it to begin with, it needs to encompass all of those things. So vocal protest is our behavior, and screaming, crying, whining, refusals are all things that we want to score as vocal protest. We need to have that in there. So some sample operational definitions that tell observers what behavior is and is not are these right here. So chewing with mouth open. Again, the operational definition for every behavior is different for every single student. Out of all of my clients, not one student has the same operational definition for the same named behavior. So if I have 2 students that chew with their mouth open, both of their operational definitions look completely different because they're individual students. Their behaviors look different. So chewing with mouth open is defined as biting down on food with teeth and or the food visible through the plane of the lips, may or may not produce an audible sound, does not include chewing when the lips are completely closed, because you can't chew with your mouth open when your lips are completely closed, right? Record a new event when more than 3 seconds passes without chewing with mouth open. We're going to unpack this in a minute here. Let's touch on throwing objects before we get to that. Throwing objects is defined as propelling any object through the air with the object making contact with furniture, the floor, or a person. So when I observed this behavior before I wrote the definition, I saw objects making contact with furniture, the floor, and a person. So I included all of those things in there so that my definition is repeatable. Does not include opportunities to throw a ball within the student's throwing a ball program. Okay, let's look at chewing with mouth open a little bit more. So I've highlighted these components in here for you. So anything that constitutes the observable piece of an operational definition is highlighted yellow. Biting down on food with teeth, observable. Teeth and or food visible through the plane of the lips, observable. Audible sound, observable. You can hear it. Does not include chewing when the lips are completely closed, observable. Measurable components. Record a new event when more than 3 seconds passes without chewing with mouth open. So that is how we are going to measure separate events of this behavior. This is the same definition that we just went over. Repeatable, test it. Observe the behavior a few times to see if it looks similar each time. Or better yet, have someone else observe the behavior and provide you with feedback on your operational definition. So sometimes I'll complete an assessment with a student, write out their behavior plan with all of their operational definitions, and then we'll do training with our behavior interventionists. And those behaviors might look a little bit different from time to time, or maybe they've changed altogether because we've had 2 or 3 weeks between assessment and treatment starting. So those are times then we actually need to tweak the operational definitions, and that's okay. Behaviors change over time. Okay, step 3, choosing a recording method. We are going to go through those, but not until we have a brief question break.
So I had a few questions that popped up while you were presenting. I'm wondering, how do we know what to record? What's an important behavior to start tracking?
That's a good question. I think you need to think of the purpose of tracking, and that will lead you to what behaviors you should be tracking. So I think that, let's say you're going in to have an assessment done for your child for a diagnosis of something. So it could be ASD, could be something else. Any behavior that looks like it might be something, you should record data on. So maybe it's like pulling hair. Maybe your child is pulling their own hair, and that's not a typical thing that you've seen from your child, or it's not a typical thing that children that age do. You may want to take data on that. So anything that's leading you to suspicions that it may be, there might be something more to it. I think if you're not going to use the data for anything, you may not need to take data. So I think thinking about the purpose of why you're taking the data can be helpful.
Needs to be useful.
Mm-hmm.
Does the mandate for taking data always come from the consultant, or do other people on the team sometimes think that have asked to record data?
Can you clarify that question?
Well, I'm wondering, how do we know? Does it always come kind of down from the consultants says this is a thing that we should be measuring and data should be taking, or do sometimes parents, or do parents do it on their own volition? Like where does that come from when, like, from the perspective of a newer team that we're kind of hypothetically talking about?
It's a good question. I think most often it comes from the consultant. And then if parents share concerns with me, I may ask them to take some data, and then I'll provide them with data collection methods depending on what the behavior is and what I know about the behavior, if I've seen it before, how well they can describe it to me. So I'll often provide them with those things and ask them to take some data, or I'll ask them to take some videos, which is awesome too. And then also some of my BIs who are more experienced on my teams will actually start to take data on new behaviors that they see that are challenging before I even ask them to. Because there's some students where something will pop up one day and you're kind of like, oh, this might just be a today thing. And then they see it in their next session as well. And it's like, yeah, this is probably not a today thing. Let's start taking data on that. So then I'll have a BI email me and say, hey, I noticed that he was all of a sudden picking his nose on Tuesday. So on Wednesday, I saw it again and I started taking data on it. He did it 20 times in my session. What should we do? Mm-hmm. So sometimes the BIs will take initiative as well to take data on new behaviors so that they can provide me with some detail with their email about what their concern is and how frequently that behavior might be occurring.
I guess it makes it measurable, right?
Yeah.
Would it only be BIs who are expected to take data, or do you sometimes ask parents and family members to take data as well?
Yeah, that's a good question. I will ask parents to take data and other family members and sometimes teachers and EAs and ABA support workers. But I think as service providers, we need to evaluate if that's actually doable. So thinking, is taking data doable for this person, given how many other things they have to do in a day, or given how much the student requires their support in a day? Can they feasibly take data? And there's different types of data, which I'll go through in this presentation, and some of them aren't super time consuming or may not require the parent to carry around a clipboard with a piece of paper on it. So I think we have to think about that. Like, is it feasible to take data, and then what's feasible for this parent? Or when funding allows and I'm able to, and the parent agrees to it, sometimes I'll just come in or I'll review video to take the pressure off of the parent, because as a parent, you have enough going on and you've hired me to take care of you. So I will try my best to not make you take data.
Okay. And then one popped up specifically related to your slide about chewing with the mouth open. Why would that be significant? Why would you or a family want to record data on chewing with mouth open?
Yeah, so with chewing with mouth open, it can be socially stigmatizing for students. And I'm not thinking just kind of chewing with mouth open a little bit. I've had students who will chew like, and food will fall out of their mouth, or they won't even actually be able to consume food because they won't close their lips while they're chewing. So that can be a challenge in many different aspects of their overall wellness. They're not getting the nutrition they need. It's socially stigmatizing. They're, they can soil on their clothing. Yeah, so it's not something that I would target with every student. I'm thinking more extreme cases.
Thank you. That's the end of my questions.
Okay, great. Thank you. All right. So let's talk about choosing a recording method, graphable data. So we can record frequency data, and you may recall from my last presentation that frequency is the count of the number of events of a behavior. So we use frequency for behaviors that have a clear beginning and end. So when does one event end and another start? So we just talked about that a little bit. So when you're counting frequency, you want it to be a behavior that has a clear beginning and end and occur at a rate that can be counted. If the behavior occurs very frequently, you may not be able to accurately record all events of behavior. So some examples of behaviors you may count using frequency are elopement. So leaving the instructional area is an example of a definition, but elopement could also be bolting out of the school doors, running out of the house, bolting out of the car, things like that. Mouthing objects, so placing objects into the mouth that are not edible is an example. Picking nose, burping, voiding, or urinating on the toilet. Like we talked about last time, just because we're measuring behaviors doesn't mean we're only measuring challenging or negative behaviors. We could also be taking data on positive behaviors or adaptive behaviors as well. Rate is another one that we could consider. So rate is the count of the number of events of behavior that occur during a time interval. So we might use this when the session or recording duration is consistent. So if a session is 2 hours every session, we could take data on the rate of something that occurs in that 2-hour session. Or let's say we're taking data on chewing with mouth open during mealtime, for example, and mealtime is always 30 minutes. And this might also be something we look at if we're only measuring behavior at some parts of the day, but not others. So like if we're measuring behavior at bath time only, and bath time is 15 minutes every time, we may look at the rate of a behavior. So with rate, you can look at anything you can take frequency data for. However, measurement across a consistent time is required. So some examples of this are, you could do some math, of course, to break it down into whatever kind of minute and second interval you want. But things like burping, for example. So if someone is making themselves burp, and we're measuring that in the hour following mealtime, we could count how many times they burp in 1 hour, and then divide that number by 60 to get how many times they burp in a minute. So that's the rate. So it's the number of events across a certain time period. We may also measure the duration of a behavior, so how long the behavior lasts for from beginning to end. So we may look at the amount of time that from the beginning to end varies. So crying may occur for 5 minutes if the child is denied access to a chocolate bar, but it may occur for 10 minutes if the child refuses a bath before bedtime. The behavior may occur for inconsistent periods of time. So sometimes spitting occurs for 10 seconds and sometimes it occurs for 5 minutes. So these are times when we may want to measure duration, when behaviors occur for longer than a few seconds and the time that they occur varies. So some behaviors we may want to measure duration for are crying, reading independently, playing in the bath, getting dressed, eating lunch. Latency is the time between the instruction and the response. So responses could occur too slowly or too quickly following an instruction. So here's an example. The amount of time that passes between a parent telling a child to clean their room and the child actually starting to clean their room. That would be the latency. The amount of time that passes between a parent saying good morning and the child saying good morning, mommy. So we may want to measure the latency there. The amount of time that passes between the BI saying your turn and the student taking his turn. So that's the amount of time between the instruction, your turn, and the response, which is the student taking his turn. So some other examples of latency include cleaning the room after being told to, taking your turn during game, transitioning to a tutoring session. So for some of my students, we have worked on having them independently transition to their tutoring session. So we're working on decreasing the latency to respond, decreasing the amount of time it takes them to transition from their iPad to the tutoring table to start working with their behavior interventionist. And then maybe the latency to turning off iPads. If you say, okay, Joey, time to turn off the iPad, it's time for dinner, measuring how long it takes him to turn off the iPad and transition to dinner is the latency. So there are also discontinuous measures which provide a sample of behavior. So these can be used when a behavior does not have a clear start and stop. The behavior occurs at such a high rate, it's impractical to count events. An estimate of frequency is acceptable. The behavior occurs over long periods of time. It is impractical to use duration recording. So again, it could be that the behavior occurs for a long period of time. You rely on someone else to collect data who cannot continuously monitor the behavior. So that might be someone like teachers, a daycare provider, or it could just be yourself as a parent. You may not be able to be there every moment recording data on the behavior that your child's engaging in. So I've put these in here for your own interest. There are lots of videos on YouTube and information online about these types of recording methods. They are advanced and they won't be covered in detail in this presentation, but I wanted to include them in here because they are an option. These are recording methods that your BCBA can also support you in using at home as well. And if you have any questions about these after you've reviewed any literature online, feel free to contact me and I'm happy to help you set up one of these recording methods if you read about them and feel like they would be a good fit for you. So their names are whole interval recording, partial interval recording, and momentary time sampling. And that's all I'm going to say about those. Okay, choosing a recording method, non-graphable data. So this is data that we cannot make quantitative or numerical or into numbers. Descriptive methods. So they provide detailed information about the antecedent or setting event before a behavior and the consequence following the behavior. These can be used when it is feasible to record details following an event of behavior. So that's, can you sit down within a few minutes after a behavior occurring to write down these details? Or does your child need support for some time before you're able to actually go and record data? The behavior does not occur at a high frequency. So this could be a behavior that occurs once or twice a day, perhaps. You may want to use a descriptive method. Data is required to determine the function of a behavior or to determine consistent antecedents that precede the behavior or consequences that follow the behavior. Let me translate this a little bit. So data is required to determine the function of behavior. The function of the behavior is why the behavior is occurring. I went through this in a lot of detail in my last presentation, so I won't cover it in detail now, but we may want to know why the behavior is occurring so that we can select a treatment that's going to be effective in treating that behavior. To determine consistent antecedents that precede the behavior. Antecedents are things that happen before the behavior. Setting events. Mom turned the lights off. The internet went out. The baby started crying. The doorbell rang. Those are all examples of antecedents, things that can happen before a behavior. And then the consequences that follow behavior is just what happened after the behavior. So mom went and comforted the child. The child went and had a timeout. Those are just some examples. I'm not saying that I implement these things. These are just examples from real life. But consequences are just things that happen after a behavior. Descriptive methods can also be used when the observer was present prior to, during, and after the occurrence of the behavior. So the observer needs to be present before the behavior happens to know what happened before the behavior happened, because that's important. They need to know the antecedent. They need to know the setting event. And they also need to be there present for the behavior to see what happened. And then also after the behavior to see what the consequence was of the behavior. And descriptive methods should also be used when detailed information is required. So I'm going to give you some examples here as well coming up. Okay, so before we dive into the really heavy technical stuff of this presentation, does anybody have any questions about the stuff that I just went through? So that was graphable and non-graphable data.
Only one, and that was, do you ever see people using multiple kinds of data at the same time? So is it if for a tantrum or for property destruction or something along those lines, is it ever appropriate to take descriptive data and duration recording as well, or some version of that?
Yeah, that's a really good question. And yes, definitely. I think there's a time and place to take multiple kinds of data for a single behavior. I think that frequency data may be something that is really important because we want to know how often something happens in a day. Like let's say screaming, for example. We want to know how many times screaming happens in a day. And then we may want to actually take some descriptive data, so very detailed data, on when screaming is very intense or prolonged, like when it occurs for a while. I may ask a parent to also take some more detailed data so that we really know what is going on in those kinds of situations. So definitely we can take more than one type of data. I know in my home intervention programs, we'll often take frequency data. So we'll count the number of events that a behavior occurs in a session. But if a challenging behavior occurs that's more challenging than usual, we'll also take descriptive data for those specific situations so that we can unpack them a bit more, because the behavior plan is in place so that those extremely challenging moments don't happen. If they're happening, we need to know why so that we can make a change. And often when I'm there, everybody's so happy to see me, the child's happy to see me, so they're not going to do that behavior when I'm there. I'm not going to get to observe it for myself. So I need that descriptive data to tell me exactly what happens so I can figure out how I can make that not happen anymore.
Now, I also am conscious that sometimes it's the data that kind of scares people. It's the overwhelm of, oh my gosh, I'm going to have to be writing something down all the time. On my own team, we've used various data recording methods over the years. You know, sometimes it's a clicker, like a golf clicker, or I know someone taped a piece of paper to her leg and was putting marker marks on it at one point, or window writers on the side of a car window. Do you have any examples of how data can be easy or on the go, or you know, approachable, considering all the constraints of you know, what it is to be working and giving your full attention to your child?
Yeah, I'm actually going to go through that in a few slides. I have a whole bunch of examples, including the masking tape on the leg trick.
Okay, wonderful. I'm jumping the gun. Okay.
It's okay. It's a good question to ask. Is that all the questions?
Yes.
Okay, perfect. Thank you. Those are excellent questions. Awesome. Okay, so now we're going to talk about recording. Start your engines. Here we go. I love this slide. I actually found the magnet in the middle when I was in Oregon a few years ago, and I love it. I have it in my office. Is it pronounced data or data? Okay, here we go. Start recording. A few important points as you select your data collection format. Your data needs to be organized. Your data needs to be easily interpreted or analyzed. Your data collection format must be easy to use so that you can use it consistently. And your data collection format must be accessible to the recorder or the observer. So that's you. Okay, so here's an example of one of the ways that you can record frequency data and count the number of events of behavior. So this is what I use on my teams to record frequency data. Every session, the interventionist puts their date and initials at the top of the column, and then they tally mark how many times these behaviors occur in a session. You can see that some of the behaviors here are things we may be wanting to reduce, so vocal protest and elopement, and then some behaviors we want to increase, like manding or requesting for help, and manding or requesting for all done. Likely we're running a program here to request for all done instead of eloping or leaving the area without asking. So if a student says, I'm all done, they can leave the area, but if they don't say that they're all done, then maybe we're recording elopement here. Okay, so this is what Elaine and I were just talking about. Frequency can also be taken in other ways as well, because I realize that a clipboard with a pen and a piece of paper isn't always doable in real life. So here are just a few examples for you of how you can be crafty and record data on the go. So we talked about the masking tape on the leg trick. So you can just peel off a piece of masking tape and you can stick it to your pants, or some people will stick it to their inside of their forearm. And they'll use a pen and they will take data on there. There are lots of ABA sport workers in schools that will actually like stick their strip of tape on their table in the morning, like write out all of their like chart that they need to write out, write down all the behaviors they're recording on it, and then stick it to their body. They wear it for the day. At the end of the day, they unpeel it off their body, and then they graph all of their data. So it's definitely something that's actually used a lot. The other method is using a clicker. Costco uses these to count how many people go inside. We use these to count behaviors that we want to measure. We may be counting vocalizations. We may be counting vocal protest. We may be counting self-injury. We may be counting requesting help. So those things can all be recorded on these clickers. These clickers are actually pretty cost effective. I think you can get a pack of 6 of them on Amazon for like $14. Autism funding also covers them. The ones on Amazon are awesome because they come in different colors. So you can, look at them and color code them when you're taking data, or you can write on them with a Sharpie. The other cool thing you can do with these, let me actually just see if I have one in my desk, is if you wear jeans and have a belt loop, or if you wear a fanny pack, you can connect a bunch of those clickers together. You can take this little hook here, stick it on a binder ring. You can get these from Dollar Tree for like 10 for $1. You stick them all on the binder ring. You can clip this right onto your belt loop of your pants. And then you're good to go. You've got all of your clickers in one place. You can also just clip it to your fanny pack as well. The other method you could use is you could use an app on your phone. So if you search behavior count in the App Store, there will be a whole bunch of apps that show up. I have never used an app on my phone to count behavior. I'm really old school. I often use the clicker or I'll use paper and pencil. But I did actually do a quick search on my Apple App Store today, and there were at least 10 or 15 apps that you can get for free to count behaviors. So that's another method that you could use on the go. Most people have phones on them wherever they are in their house or when they're out in the community. So that might be another way that you can count behavior. So we can also look at rate. So we're using the same data collection systems as frequency, but we use the measure of rate when the recording time stays the same. So this is just where you would need to be mindful of how much time you're recording for, so it would be consistent. So again, if it's mealtime, it's 30 minutes. If it's your ABA home session, it might be 2 hours. So you would be able to derive a rate from the frequency and the time. Duration is how long the behavior lasts for from beginning to end. So here's just an example of a table that I made in Microsoft Word for this presentation. This can be helpful because you can record multiple durations of behavior on a single chart. So for this one here, you can write your date and initials, the time that the behavior started, the time that it ended. So if you just have a clock, you can write the time on here. You don't actually have to have a stopwatch on you. You could just look at the clock or look at your watch and write down the start time and the end time. Then you can get the total duration from that without actually having to have that extra piece of equipment on you, like a stopwatch. And then on this one, you can check off if you measured vocal protest or playing games on iPad during that duration measure. If you're only measuring one thing for duration, you can just get rid of the extra column. You could just be measuring one thing, that's okay. But this is just an example as to how you could measure multiple behaviors on one chart. So you could also use a stopwatch on your phone or just a regular plain old stopwatch to measure duration as well. The other piece here is that we may be looking at duration across time too, which is a little bit tricky, but I'll explain it. So if we're thinking about duration, maybe in a day, let's say, so like, let's say on Saturday, you want to measure how much time your child is engaging with toys independently. So every time your child is engaging with toys independently, you're going to start your stopwatch. Every time your child stops, you're going to stop the stopwatch. And you are going to keep starting and stopping the stopwatch all day long. At the end of the day, you're going to see how much time you have on your stopwatch. That is how much time all day, the duration that your child played independently with toys. So you can also measure duration in that way, or you can measure duration of single events of behavior, like a duration of crying in the morning at 10 o'clock. And then maybe crying occurs again at 11:30. You measure it separately then too. So you end up with these bunches of minutes throughout the day. Latency. So latency is the time between an instruction and a response. So for this one, again, just a simple chart that I made on Microsoft Word, date and initials, the latency. So this is where you'd want to use a stopwatch. So you could present the instruction, go clean your room, start your stopwatch. As soon as kiddo starts cleaning their room, stop the stopwatch and write down the latency. So the latency is the amount of time it took for them to start the instruction with their response. So some things you could take latency data on: cleaning room, making lunch, maybe greeting grandma in the morning if grandma lives with you. For some kiddos, it's latency to ask for help. So maybe what we're doing is measuring how long it takes them to ask for help when they need help to complete a task. That might be something we're trying to decrease the latency of. We want them to ask for help quicker so that they don't become agitated. That's a good measure for latency. Again, you will need a stopwatch for this most likely. Often latency will be measuring in seconds, not minutes. So a clock may not be as useful for this one, so you'll likely need a stopwatch. So some examples of descriptive methods here. These are the ones that I shared during my last presentation as well. These are 2 examples of ABC charts, which are a common descriptive method. ABC stands for antecedent behavior consequence. The first chart here is one that we may use that is just a really quick way of recording when a behavior happens, what may have caused it, and what happened after the behavior. This is something that's really easy to do. You can just check off a few boxes and you're on your way. This is not a time-consuming measure at all. So on here, I ask the person to write down the date and the time that the behavior occurred, what happened before the behavior, a task, prompt, or an instruction was presented. The behavior was elopement, so that was leaving the instructional area. And then access to a preferred item was the consequence. So for example here, we said to the student, okay, it's time to do your puzzle. The behavior was the student left the table, and then the consequence was, okay, like, never mind, you can just play on your iPad. That might be access to a preferred item. This is just an example. Another way that we can record ABC data is using a chart like this, where we're actually writing down details. This is the chart that I use in my practice. And we adapt it. It's not a thing that we have to stick to, so it's adapted as needed, but I really kind of like this format. So we put in our date and initial here. The antecedent, what occurred immediately before the behavior. So we want to know the location of the student, the location of the adult, the activity of the student, the activity of the adult. The behavior, so describe objectively what happened. The student screamed and threw the blocks towards me. When the ramp fell down, he ran into his bedroom and slammed the door. So this is very objective. We didn't say he got mad, because mad is subjective. When I get mad, that looks different than when Johnny gets mad. So we want to say exactly what the behavior looked like. Observable. Think observable. The consequence, what occurred immediately following the behavior. So what physical action did you take? Walk to the student's door. What did you say? I'm sorry that your ramp fell down. Let me know if you need help to calm down. Duration of the behavior. So there can also be a duration measure embedded in this. So this may have occurred for about 8 minutes. Some behaviors are very quick to end. They may be less than a minute. So my BIs might write on there like 20 seconds or something like that as well. So what do I do with raw data? Translation. What do I do with all of the tally marks and all of these numbers that I've recorded? Well, you're going to graph it. So note that data from descriptive methods like ABC charts cannot be graphed. Okay, so you need to be using a quantitative method like frequency or rate or duration or latency. So you should use a line graph. A line graph is the most common type of graph used in ABA. It's also very easy to graph a line graph. It's not time consuming, regardless of whether you use paper and pencil. or you use a digital method. So here, this is a line graph. So this is a whole bunch of tally marks translated into numbers, translated onto a nice graph that we can analyze to see what's happening with this behavior. So a line graph can display one or more behaviors or skills, and a comparison of data points reveals changes in level, trend, and variability. See my last presentation for more on that. I go through how to analyze graphs. Tips for graphing. Graph each behavior on a separate graph. If you're graphing using Excel or a digital method, you'll be able to superimpose the graphs on themselves if you need to, or you'll have a professional that can help you do that with Excel. Or you can watch a YouTube video as well. That's how I learned to graph in grad school. I watched a lot of YouTube videos on how to graph using Excel. It's challenging. Mark off your data once you've inputted it into the graph. So if you're taking frequency data and tallying up the number of events of asking for help in a day, and you're only graphing every few days, make sure you check off once you've graphed so that you're not making errors when you're putting that information into your graph. Paper graph or digital? Either's fine. Do what works for you. In all of my home programs, I still use paper and pen data collection. I don't use the online data collection software. So do what works for you. Some of my graphs are digital, and I shared those during my last presentation for my monthly progress reports for my students, but that's really it. Everything else is in the program binder and it's paper copy. I just drew up this quick paper sample today to show you how nice a paper copy can still look. If you use black pen, which is my favorite, your graph looks like you did it on a computer. I just used a ruler here, and this took me like 20 seconds to put this together. I just realized that I put the date where my initial was. Anyways, disregard that. But this is what a paper graph can look like. It looks really nice. So totally use paper if that's what works for you. So on this graph here, I typically count behaviors in 30s on a graph. I have my label here, number of events of vocal protest per session, and then I've just graphed a bunch of numbers here so that you can see what that looks like. Here's a digital sample. I didn't use the same numbers for this as I did in the previous graph. That's why the graph looks a little bit different. But again, it looks nice. Either way, it's good. All right. Any questions about those things before we get into some examples?
I didn't actually have any questions that time around. I did want to share a little bit, just you, like every consultant I've known, love graphs, and I could feel the the appreciation of a well-drawn graph with a ruler, and I think that's always I've seen teams really start to enjoy just that as well, because not only does it look nice, but you can see the progress, and you can see how meaningful taking all this data can become. I wanted to mention that sometimes digital graphs can be super helpful when you have a big team, and when you're sharing with a school team, or there's someone in the school district who also you're including in the loop. Or especially during COVID, if you have someone at the school who is taking data, but the consultant can't go in as frequently and can't physically see it, that rather than Excel, the Google Sheets, or there's some other digital software as well that's been really great, that you can see in real time. Not many people really want to sit and watch it happen in real time, but you could see, you could check in daily. And as a parent, I can check and see what's happening and how are things progressing, because the data tells such a story.
Mm-hmm. Yeah, you're totally right. And that's been one of the great, there's not a lot of great things that happened during COVID, but that's one thing that's been really nice, especially with some of our school district collaborations with the skills-based treatment we've been doing. We've been able to use Microsoft Teams, and there's actually like Excel sheets in there, so we can share the data that way, which is really nice. So I have really enjoyed using that method to be able to check in on school data, and even for school to check in on home data, I think, as well. And Google Sheets is also really awesome. I use that for my home teams that don't have access to Microsoft Teams for skill-based treatment data. So definitely, I think it's totally a thing that we can incorporate into programs, and it makes data easier to send too. Really, not everybody has a scanner or the time to scan 100 behavior graphs from your home program binder to your doctor, for example. It's nice just to share a Google Sheet and everything's there.
Love technology.
Yeah. Okay, so I'm going to get into some case examples here. Now, I'm going to talk about two examples. Both of these are completely hypothetical, by the way. These have nothing to do with my clients at all. And after I go through these two, if you have any questions about specific behaviors you want to start measuring for any reason, please put them in the question box, because I'm happy to kind of talk through what measure might actually be effective for you to start with. And I'm also happy to provide you with any materials that you need to get started on measuring those behaviors. So definitely think about that as I go through these examples, and please do reach out if there's something I can help you sort out in terms of what method to use to collect data for that behavior. Okay, examples. So the first example is going to be Patricia. She is a 6-year-old girl who engages in fingernail biting. She started biting her nails when she was 4, but it was never an issue until recently when her cuticles started to get infected. So step 1, identify the behavior or behaviors to be measured. We're measuring fingernail biting. We can call it whichever one of these we want: fingernail biting, nail biting, biting nails, whatever you like to call it. Any of those names would work. Step 2, develop an operational definition. So my definition that I came up with was placing any part of the finger past the plane of the lips and biting down onto the nail with her teeth. Does not include licking fingers when the tongue is visible past the student's teeth. So I've said what the behavior is here, and I've said what it's not. Okay. Everything in here is observable, and everything in here is measurable, and everything in here is repeatable. The one thing I could probably do here to improve my definition might be to add the measurable part, where I say something like, count a new event if the student has her fingers out of her mouth for more than 3 seconds, or something like that. So that's an improvement I could probably make to this definition, just to make it a little bit easier for multiple observers to take consistent data. Then I'm going to choose a recording method. So if you know why fingernail biting is occurring, you could choose a graphable method. So you could count how many times it's occurring. For example, if you don't know why fingernail biting is occurring, you may want to choose a descriptive method so that we can figure out the function or why she's engaging in that behavior. Then use a graphable method. But we could also do both, or we could just start with a graphable method. So option 1, we take frequency data. We measure how many times the behavior occurs per day, per session, per recording period, whatever we decide. Option 2 is that we use descriptive recording. So we use one of those ABC charts to record the antecedents, so what happens before the behavior and what happens after the behavior. So for option 1, measuring the frequency, choose a data sheet or recording method and start recording. Choose one of your frequency methods. Choose your tally data sheet. Choose your masking tape on your leg, your tally counter, or your clicker, or download an app, or something else creative that you might think of. Graph your data every few days or every day. So if you're using a tally counter, you're going to have to graph your data every day because you have to reset it to start counting the next day. Probably the same thing with some apps that you might use depending on if they're free or paid. And your masking tape, you'll probably want to record that as well every day, because it would be the worst thing if your tape got crumpled up and you didn't actually graph your data. So here's an example of a quick frequency chart and graph that I put together. The frequency chart that I used here does actually align with the graph. So I did graph those exact numbers onto my graph. You can see here, these are separate days. So June 8th, June 9th, June 10th, and June 11th. And then I took tally data throughout the day on every event of fingernail biting. And then here I graphed all of those points. So option 2 for this one, we could use some descriptive recording, an ABC chart, to record the events that occur before and after fingernail biting. So you can choose your data sheet and you can get recording. So here's an example of the ABC chart that I currently use in my practice. So I filled it out here for this example. So location of the student before the behavior was sitting at the dining table. The adult is standing in the kitchen. The student's playing iPad, and the adult says, "Time to put away the iPad." The behavior of the student, Patricia began fingernail biting and looked at me as she bit her fingernails. What physical action did you take? None. What did you say? Don't bite your nails, Patricia. And then how long did this occur for? About 1 minute and 20 seconds or so. So this is an example of how you can fill out an ABC chart. File completed ABC charts for analysis by your provider. Okay. Any questions about that first example before I move on to the next example?
Nope.
No. Okay. Perfect. All right. Next, we're going to talk about Matt. Matt didn't get a picture today. I'm sorry. Matt is an 8-year-old boy who started antibiotics for an ear infection yesterday. His mom observed an increase in agitation over the past few weeks and is concerned that he is regressing. So step 1, we need to identify the behavior or behaviors to be measured. So agitation could be one, vocal protest, or general upset. All of these could mean the same thing, but we need to pick some term to describe the behavior that's occurring. So we're going to choose the term agitation, and we're going to create an operational definition. Agitation includes crying, screaming, whining, emitting sounds like ugh, negative commenting, like this sucks maybe, or this is stupid, and refusals like I don't want to. So that's our operational definition. Choose a recording method, step 3. Our purpose of collecting data on agitation for Matt is to assess if he's becoming agitated because of his ear infection or because of a potential regression. We should choose frequency data recording. But why? We can take baseline data on agitation right now. Once Matt is cleared of his ear infection and finishes his antibiotics, we can continue to record data on agitation to see if the frequency of agitation decreases, increases, or stays the same. The data will tell us why agitation is or was recording. Data is a magical thing. So if we take baseline data is something that we take before an intervention, but in this case, it's before he's healed. Then we'll know what's going to happen with that behavior in the future. Let's see. Choose a recording method. Matt is an active boy, so his mom opted to collect data on agitation using an iPhone app so that she could easily record each event of agitation when it occurred in the home or outside of the home. At the end of each day, Matt's mom checked the frequency count for agitation on her app and graphed it. So this is just a snapshot from her app for each of the days that she's been recording data. And this is her graph. She graphed all of those numbers from the previous slide onto this graph here. Then on June 13th, Matt finished his antibiotics and was cleared of his ear infection by his doctor. Matt's mom drew a phase line on her graph to indicate that the ear infection was gone and continued to take frequency data for 1 week. So if you recall from my last presentation, a phase line, this little dashed line, is something that you put in between data points, which are these dots, to indicate that there was some change in intervention. So in this case, the changes were going from being on antibiotics and having an ear infection to being healed and no longer being on antibiotics. So we're making some change. Then she's going to continue taking data for the following week after the healed ear infection. And this is her data from her app in her phone. Then she's going to graph that data. So notice here, as I talked about again in the last presentation, these data points aren't connected because we're not measuring the same thing. In this first piece of the graph, we are measuring ear infection and being on antibiotics, agitation. And on this side, we're measuring post-antibiotics, post-ear infection levels of agitation. So you can see here that our agitation increased and then it was actually slowly decreasing. And then over here, agitation continues to decrease and remains very low. So, sorry, let me say one more thing about that before I go over here. So you can tell from this graph that likely the increase in agitation that happened over the past few weeks is probably because Matt had an ear infection for some time, and maybe he just couldn't communicate it with his family. So he became more agitated because he was in a lot of pain. And then when he went on antibiotics and his ear infection was healed, then we saw less agitation because he wasn't having ear pain anymore. So this graph tells us that in fact, Matt did not regress. His agitation was likely caused by a medical issue like an ear infection, which is why it's important that we rule out medical issues before we put in interventions. And that's something that your provider will talk to you about from time to time, is that there might be some medical issue that's causing a sudden increase in a challenging behavior, and it may not just be something within the child or a change within their environment that may be producing that increase in challenging behavior. All right. Any questions about anything from this presentation? Because this is the end of it.
Wonderful. Actually, from that last example, what made me wonder is, can you tell from the data if the change in behavior or the frequency, what's being measured, is, we've guessed wrong? What if it's correlative? So in the case of Matt, what if you're measuring his agitation, but while he also is going on and off antibiotics, he also has a substitute teacher at school? Is there a way of assessing that or sussing that out?
Yeah, it would be tricky. I mean, if both were happening at the very same time, it would be really, really hard to know. Like if the substitute teacher finished up and his regular teacher came back at the same time that his ear infection healed, it would be really hard to know. I guess the only way we would really know is if agitation remained, like if agitation started at school at the exact same time that the substitute teacher came in and agitation started at a different time at home, then we might know there's kind of different causes. I don't know if that makes sense if I'm rambling, but it would be tricky to know. And sometimes it is hard to know. We'll likely know, though, if we're wrong, too, if the same event happens again in the future and we see an increase in agitation again in the future. So in the example of a substitute teacher, he's likely to have a substitute teacher or EA again in the future. So we'll actually be able to find out then, too, that if the agitation increases again, maybe it was because of that and not because of the ear infection.
I guess that's one of the great things about having broader team meetings and having more people in a child's life kind of come together and share those pieces of information too, right? So that,
yeah, and I think sometimes it's good to be hyper aware of things too, like sending a quick email to the whole team and being like, there's been 2 days where he's been really off, really agitated, I'm not sure what's going on. And then mom might be like, yeah, like the last 2 days at home too, he's been like, you know, getting really upset with me and wanting to spend more time alone in his room and just overall not very happy. and then we might be on to something, right? So it's nice to have that really close team communication to keep on track with these things. Because I think the longer that we leave them to, the longer that that person is in distress and discomfort, it's not fair for them. We want to be able to help them. But also we don't want to establish a long history of challenging behavior either, because it doesn't take much to do that.
Mm-hmm. Mm-hmm. Makes sense. So I have a broad question for you, kind of based on your whole series. And I'm wondering if, in your words, you can kind of explain why it's important that parents know this stuff. You know, we have behavior consultants, we have BIs who are being trained by behavior consultants. Why do parents need to understand about data and understand about all the terminology that we've covered across this series?
Yeah, I think it's important to have some knowledge of it, and it's not an expectation that every parent would learn everything that I've presented on at all. But I think it's nice just to really fully be able to understand what people are talking about in your presence and in emails, because I mean, everyone hopefully has your best interests at mind, of course, but there might be something that you see that if you're not sure of the terminology, it might be something that you actually disagree with, but the terms just limit you from really fully understanding that. So I think being able to fully understand everything is important to provide your consent for your child. I think that piece of it's important. I think it's also important to be able to open up your child's program binder or open up the app that stores all of their data just to see how they're doing. I think it will really reassure a lot of the stresses that you have about your child's progress and your worries about their development. If you can kind of crack open that binder and see like how many short-term objectives they mastered today, or that they've learned to do, 10 different independent play tasks in a month. Like all of the amazing things that they're doing that can be so reinforcing for you and reassuring. I think it's important to know a little bit about that stuff so that you can connect with that binder that's in your home all the time to see that awesome stuff that your child's doing, with your team and with your support too.
Yeah, no,
Um, I think also, yeah, just fully understanding your child's treatment program. That's really important for me with my families, is getting informed consent. And I know I can't do that unless I explain things in understandable terms to parents. And sometimes I'll use terms during a team meeting by accident that are behavior analytic, and I don't explain them in layman's terms or in parent translation. So it's nice when parents have base knowledge so that when I make those mistakes, they can still kind of understand too what I'm saying, even though I don't expect them to. I should be better at doing those things. And it's something we all have to work on. We get caught up in the moment talking to our BIs and behavior lingo. And so, yeah, those are just a couple of reasons, but I think it's just important to connect with your child's treatment program because it's really important for their life.
No, I couldn't agree more. I think that's absolutely true. I think, and that's why we named the series the Empowering Parent series. Is I just think that a parent being an active participant and being able to interpret what's going on based on the data and engage in conversations with longer term planning with a consultant, I think it's right to the heart of why the ASN exists. And I just want to thank you so deeply for investing your time and volunteering. I know this has been quite a labor of love to create these 3 presentations, and we've discussed that we would like to make them available to the parent community on an ongoing basis. I am going to share my screen. Actually, can you stop sharing your screen? Thank you. And there, I'll share mine. There we are. We have a ASN water bottle and face mask that we're going to send you as a thank you. Can begin to scratch the surface. This has been 3 presentations, so I think we'll throw in some gift cards there as well. But we certainly do, feel a lot of gratitude to the time that you've committed to this, and it's been such a valuable presentation for sure.
Thank you. I've really enjoyed this. I really have.
My pleasure. We'll have to have you back to do some more presentations for us. I know we had a good conversation about, okay, now I need to stop sharing, about different topics that might be useful to all of us. Okay, stop sharing. There we go. I have too many things open on my screens. But thank you so very much for our series of empowering parents. And,
and thanks for everyone for attending tonight. I hope to meet you all in person one day.
Oops, there we go.